Conway Medical Center and WPDE News Channel 15 present Your Health, Your Decision.
Plantar fascia is a ligament on the bottom of the foot, and it starts to pull in the heel bone. And it can pull in the heel bone enough that you can actually get a spur. The old term was heel spur syndrome. That word's still around. You may have a spur on your x-ray. We'll evaluate to make sure you don't have a stress fracture. But it's also just the inflammation of the fascia. So I really tell people plantar fasciitis, heel spur pain are really the same thing, and they're used interchangeably in 2014. But very common, we see a lot of it. Get an evaluation because it really could be a lot of things. I've had people come in. I had a lady a couple months ago come in. It was actually a stress fracture of the heel, and we saw the line in the x-ray. So I think it's important to have it evaluated, make sure it's not a stress fracture, make sure it's plantar fasciitis, and there's a lot of different treatments for it. Stretching, anti-inflammatories, injections, sometimes surgery, but usually I get people better without surgery. I think I operate on probably less than maybe 2% of the people I see all year with surgery. We used to do a lot of surgery for it. Used to be that was the mainstay treatment. Oh, you got a spur, take the spur out. But we found just through the years that most people with conservative care will get better. So if you're talking to someone about a surgery with it, I would make sure you've been through a lot of conservative care before you do, because with the surgery there are risks. And so you should go over that with your doctor before you have it done. So, ingrown toenails. Certainly if you're a diabetic or a patient has very poor circulation or can't see, you need to come have me look at it, or a doctor. If you're younger and healthy, a lot of them try to get it out themselves. They get in the quick and get it out, and I hear it works. But you do run the risk of infection, and if it gets infected, you run the risk of other risk. But yeah, it's you can do it yourself, but I don't know, it's kind of painful to do yourself. We call it bathroom surgery. Make sure a lot of people don't have clean instruments. If you come to do it with us, we can do it within. We do so many of them. We can get it out in about 15 minutes. We have some medicine. I guess the key point I like is we have medicine that we can put in the corner to keep it from growing back. It's about 90% effective. So if you come and have me do it, we can put the medicine there, and 9 times out of 10 it's not going to come back, so you're not going to worry about it again. I've had some ingrowns that have been so bad that the toe has been so swollen that if you have an ingrown for a long term, one of the risks that people don't realize that you can actually develop a squamous cell cancer because the skin is under inflammation for so long. And I've had some patients I've had to biopsy to check for that, but it is one of the things to look out for. I've only encountered a couple of times maybe, but I do hear they do lecture about the conferences, so people are encountering that. And so if you have an ingrown, if you're young and healthy, maybe you could get it yourself a little bit, but I don't know. I would come see me, I'd get out quicker, and we could hopefully prevent it from coming back. Turf toe is basically arthritis of the big toe joint. And it happens it's right where the thumb is up here, where the big toe bends up. And it's usually after repetitive bending of the toe or jamming of the toe. And people can develop, a lot of athletes get it because when they play on the turf, they're running, they're cutting, and the toe gets bent a lot, and inflammation, then you get some spurs in there, and that's what turf toe is. And it can be very painful for people. I know there's some famous people who had it last year. Some of the football players did. Usually something treatable, though. Usually something we can get you through without surgery at a young age if you're in college. Usually anti-inflammatory. Sometimes I inject them. Sometimes it's just modifying your shoe to take pressure off it so your toe doesn't bend as much. And that seems to work. Sometimes we do have to do surgery. We do have to go in there and clean the spurring out. Sometimes we actually cut the bone to shorten the bone so there's less pressure on the joint itself in the area. And that's another thing we can do. We do deal with gout. And gout we see that a lot. They come in. And gout is, I think it's really it's something people inherit. And let me explain what gout is. People don't really know what gout is. The word sounds probably worse than it is, but it's the buildup of uric acid. And when we eat foods, normal breakdown is to uric acid. And uric acid comes out in the urine. I mean, you can't see it because it's soluble. But I tell patients, think of sweet tea, you know, and we fill that sweet, we put the sugar in there, and what happens when we put too much? It comes down the bottom. And that's basically what gout is. We get it in our blood, in our system, and it comes out in the feet. A lot of times around the big toe joint. Usually comes on suddenly, usually at night, and usually after eating shrimp or crab, but you can get it from anything. I mean, I've seen it with all kinds of foods. But yeah, if you want to, if you come in, a lot of times I'll give you a shot. Sometimes we'll try some medications, but we can get you better probably 80% in 2 days. I can get you better. Sometimes patients call me and say, Dr. Myers, by that night I was 70% better. So yeah, certainly come in. It's not really serious, but it can be very painful. Some people say it even hurts to have the sheet touch their foot. You know, a lot of people come to me with bunion pain and ask me, Dr. Myers, I have this bump. Do I need to have surgery to correct it? And I usually ask them, before I get started, a bunion is usually a bump on the inside of the foot, usually behind the big toe joint. I think there is a heredity component to it. Also, wearing narrow toe shoes may make it speed up. I'm not sure if that's really proven, but you would think if you're wearing a narrow toe shoe, it could speed it up. But a lot of them ask me, Dr. Myers, do I need surgery for this bunion? And really, I ask them, well, how are you having pain from it? And not all bunions are painful. I mean, some people, I say a lot of people with bunions, they're doing fine, no pain, it's there. And I tell them, no, I would not operate on it. You know, I use the analogy of, hey, if the truck's driving right, let's don't play with the wires inside. Now, the other thing people ask me, well, when should I have surgery on bunions? And what I tell people is if you're having a little bit of pain from it, achiness every now and again, I would just live with it. But if you're getting pain where it's limiting what you want to do, maybe you want to walk more, if you're trying to be active, or then I would consider surgery for it. So everyone has to make that call where they are. Bunion surgery, you know, I hear people say they had horror stories of bunion surgery. Everyone's bunion is different. And some bunions are small where we can do what I call a simple procedure. It's just shaving the bump. We can get people back to activity. Some people's bunions are more involved where we actually have to cut the bone and actually put a pin in there. Some bunions are so severe we have to do maybe 2 or 3 cuts to get the bone straight. And that would be more when you have to be in a cast. So there's probably 100 different operations for bunions. People don't really know that, but there probably are. But it really depends on you individually. So if you had a friend who had a bad experience with a bunion operation, come in and have yours evaluated because yours could be totally different and totally different recovery time.
For more information, visit us online at conwaymedicalcenter.com.